Bismillahirrahmanirrahim. Let's start with the quote of the day. The body heals with play, and the mind heals with laughter, and the spirit heals with the joy. Today we are going to discuss about the occupational disease classification and pneumoconiosis, and I am giving this presentation under the supervision of Professor Saira Afzal. The learning outlines of today's presentation is about the classification of occupational diseases, pneumoconiosis, and the different diseases in pneumoconiosis that are silicosis, cold-worker pneumoconiosis, asbestosis, bagasosis, bicinosis, farmer's lungs, recent updates, and at the end are the MCQs. By the end of this presentation, participants will be able to classify occupational lung diseases and will be able to describe different occupational lung diseases. Now, the classification of occupational disease. Disease may be caused due to the physical agents like heat, that may cause heat hyperpyrexia, heat exhaustion, syncope, and cramps, and the cold that can cause trench foot, frostbite, and chilblains. And the light can cause occupational cataract and minor nystagmus. Pressure can cause Cashian disease and air embolism. While the radiation can cause cancer, leukemia, aplastic anemia, pancytopenia, and the mechanical forces can cause injuries and accidental factors. Electricity can cause burns. Now, the disease is due to the chemical agents. The gases that can cause illness are carbon dioxide, carbon monoxide, ammonia, nitrogen, hydrogen sulfide, hydrochloric acid, and the sulfur dioxides. And the dust that cause pneumoconiosis that may be due to inorganic dust that include coal dust that causes anthracosis, silica dust that causes silicosis, asbestos dust that causes asbestosis and ultimately lung cancer, and the iron that can cause cirrhosis. Now the organic dust that are originate from the that have their sources from the vegetables, like the cane fiber that can cause bagasosis, cotton dust causes bicinosis, tobacco dust causes tobaccososis, and the hair of the farm lungs are caused by the grain dust. The metals and their compounds, toxic hazard from can result from lead, mercury, cadmium, manganese, beryllium, arsenic, and chromium. And the chemicals like acid, alkalis, and pesticides can also cause the occupational diseases. The solvents like carbon bisulfide, benzene, trichloroethylene, and the chloroform all has the ability to of causing occupational diseases. One of the disease due to biological agents, various microorganisms like Brucellosis, leptospirosis, anthrax, actinomycosis, hydatidosis, um, trichosis, tetanus, encephalitis, fungal infection, etc. Occupational cancers can be caused in the workplace by like the cancer of the skin, lungs, and the bladder. Occupational dermatosis, like the dermatitis eczema, and disease of the psychological origin can be caused in industry, neurosis, hypertension, and the peptic ulcer disease. Now coming towards the pneumoconiosis. Dust within the size range of 0.5 to 3 micron is a health hazard producing after a variable period of exposure, a lung disease known as pneumoconiosis, which may gradually cripple a man by reducing his work capacity due to lung fibrosis and other complications. The hazardous effects of dust on the lungs depend upon a number of factors like chemical composition, its fineness, concentration of dust in the air, period of exposure, and health status of the person exposed. Therefore, the threshold limit values for different dusts are different. In addition to the toxic effect of the dust on the lung tissues, the simple imposition of the infections like tuberculosis may also influence the pattern of pneumoconiosis. Important dust diseases are silicosis, anthracosis, bicinosis, bagasosis, asbestosis, and farmer lungs, as we have already discussed them. Uh, Silicosis. Among the occupational diseases, silicosis is the major cause of permanent disability and mortality. It is caused by inhalation of dust containing free silica or silicon dioxide. Its occurrence has been uncovered in various other industries, like in the mining industry, coal, mica, gold, silver, lead, zinc, manganese, and other metals, pottery and ceramic industry, sandblasting, metal grinding, building and construction work, rock mining, iron and steel industry, and several others. Here are the pictures showing the silica dust that are originating from the grinding of the rocks. The types of silicosis. There are three types of silicosis depending upon the airborne concentration of crystalline silica to which a worker has been exposed. Chronic silicosis that usually occurs after 10 or more years of overexposure. Accelerated silicosis that results from higher exposure and dwells over 5 to 10 years, and the acute silicosis that occurs where exposure are the highest and can cause symptoms to develop within a few weeks or up to 5 years. Its prevention involves the substitution engineering measures, workplace practices, and the personal protective equipments. Coming towards its hierarchy of prevention, in the first number there comes the elimination, then is the substitution, then the engineering measure, then the administrative control, and at the bottom are the personal protective equipments. Substituting the silica means using a different safer material in place of silica containing substance. It is true that in some cases it is not possible to use a substitute in place of silica, but for many operations such as abrasive blasting, there are many possible substitutions including those below: aluminum oxide, ambient polycarbonate, cryogenic polycarbonate, amerigranate, glass blends, melamine plastic, novaculite polycarbonate, silicon carbide, and the stainless cast. Now the engineering controls in which we have to keep silica out of the air. For this purpose, we need to install a water hose to wet down the dust at the point of generation, as shown in this figure. The worker has been using water sprinkling while grinding the rock. Install local exhaust ventilation. During rock drilling, flow water through the drill stem. Install dust collection systems onto machines or equipment that generate dust. Use concrete masonry saws that provide water to the blade. Work practices. What employees can do to reduce silica intake? They have to participate in any air monitoring or training programs offered by the employer. If possible, change into disposable or washable work clothes at the work site. He needs to take shower and change into clean clothing before leaving the work site. Do not eat, drink, use tobacco products, or apply cosmetics in areas where there is just containing crystalline silica. They need to wash their hands and face before eating, drinking, smoking, or applying cosmetics also outside of the exposure area. If using respirators, do not alter the respirator in any way. The personal protective equipment that the worker needs to have them to reduce the risk of silicosis. Personal protective equipment against silica includes respirators and masks. Respirators should be used only when the dust controls cannot keep dust levels below the recommended exposure level. There are many types of respirators, from air purifying to air supplying, and from a nose and mouth covering to a full body respirator. Now coming toward the anthracosis, that is also called the coal worker pneumoconiosis, that are caused by inhaling the coal dust. It is caused by the accumulation of coal dust in lungs and the tissues reaction to its presence. It is associated with coal mining industry. Takes 1 or 2 decades to cause symptoms. The disease is divided into two categories: simple coal worker pneumoconiosis and the complicated coal worker pneumoconiosis, or it is also called the progressive massive fibrosis. The simple form causes the focal aggregations of coal dust-laden macrophages that are called coal macules. Patients have slight cough and blackish sputum. While in the complicated form, that occurs after many years of underground mine working. It causes fibrous scarring that appears complicated, also called the progressive massive fibrosis. These are the lung pictures of the simple coal worker pneumoconiosis, and this is of the progressive massive fibrosis. The byssinosis. It is caused by inhalation of cotton fiber dust, and it occurs in the textile and the fiber industry workers. Its symptoms are chest tightness, shortness of breath, cough, and wheezing. It typically occurs when patients return to work after a weekend or vacation, and the smoking significantly exacerbates the byssinosis. As in this picture, you can see that the workers who are working in the cotton industry. When byssinosis is detected in its early stages, byssinosis is reversible by eliminating exposure to the responsible irritant. When exposure continues, the byssinosis can cause permanent damage to the lungs, that is called the chronic byssinosis. In its treatments, in acute setting, patients are encouraged to consider alternative occupations or at least reduce the exposure in the work environment. Smokers should be encouraged to stop smoking. In the acute stages, treatment may include Bronchodilator for symptomatic relief. Corticosteroids are best avoided for as long as possible, given only in severe cases. So in chronic byssinosis, include the supportive measures. Nebulizers use home oxygen therapy, physical activity, and breathing exercise may help in the management. The prevention includes the medical measures, engineering, and the other measures. Medical measures include pre-placement examination, periodical medical examination after the employment, medical and healthcare services notification, or if patient reports any symptoms related to the byssinosis, maintenance and analysis of the records, health education and counseling, practicing good personal hygiene. Good personal hygiene includes washing hands and face before eating, drinking, going to toilet, and smoking. Do not eat, drink, smoke, or apply cosmetic in areas where silica is being used. Wear protective clothes and respiratory protective protectors. Before leaving work, shower and change into clean clothes and leave dusty clothes at work. Engineering measures include the design of building, conduct air monitoring to measure the workers' exposure to crystalline silica, minimize exposure by controlling the creation of airborne particles, for example, use wet tailing, local exhaust ventilation. Personal protective equipment, uh, these are related to the silicosis. Coming towards the bagasosis. Bagasosis is the name given to the occupational disease of the lung caused by inhalation of the bagasse or the sugarcane dust. It occurs mostly in the workers who work in the sugarcane industry or the sugar mill. The symptoms consist of breathlessness, cough, hemoptysis, and slight fever. Initially, there is acute diffuse bronchiolitis. Cicagram may cause mottling in lungs or shadow. There is impairment of pulmonary function. If treated early, there is resolution of the acute inflammatory condition of the lung. If left untreated, there is diffuse fibrosis, emphysema, or bronchiectasis. Preventive measures include dust control, measures for prevention and suppression of dust such as wet process, enclosed apparatus, exhaust ventilation system should be used. Personal protection include the personal protecting equipments that are mask, respirator, mechanical filters, and that may be necessary. Medical control includes initial medical examination and periodical medical checks for workers are indicated. Bagasse control by keeping the moisture content above 20% and spraying the bagasse with 2% propionic acid. A widely used fungicide, bagasse can be rendered safe for manufacturing use. Now the asbestosis. Asbestosis is a chronic disorder of the lungs which results from continuous inhalation of asbestos fibers over a prolonged period of time. In this picture, these are the asbestos fibers, and it is mostly found in the ceilings and the roofing. This is the chest radiograph findings of the parenchymal asbestosis. These are the small irregular oval opacities. It causes shaky heart sign. Preventive measures include use of safer types of asbestosis, that is slide and amosite, substitution of other insulants, glass fiber, mineral wool, calcium silicate, plastic foams, and etc. Rigorous dust control, periodic examination of workers, biological monitoring, and continuous research. Now coming towards the farmer's lung. It is caused by inhalation of moldy hay grain dust. This is the dust that is originated from the grains. When the moisture content is greater than the 30%, it favors bacteria, fungi growth, and the rise temperature 40 to 50 degrees centigrade favors the thermophilic actinomycete. Micropolyspora fanae is the main cause. Repeated tricks can cause pulmonary fibrosis and damage can cause the pore pulmonale. These are the investigations that can help in diagnosis of the uh, uh, grain dust, grain dust that is called the farmer's lung disease. These are the chest X-ray and the CT scan. Its prevention includes dry clothes before storage, work in ventilated areas or outdoors, wet on dusty areas prior to working in them. Wet hay should be inhaled, key to stopping mold growth, and consider respirators. Coming towards the recent updates, this is the first article whose title is A Cluster Randomized Control Trial to Reduce Respiratory Effects of Cotton Dust Exposure Among Textile Workers. That is the multi-text randomized control study. In its background, they determined the effectiveness of an intervention to reduce cotton dust-related respiratory symptoms and improve lung function of textile workers. They undertook a cluster randomized control trial at 38 textile mills in Karachi, Pakistan. The intervention comprised training in occupational health for workers and managers, formation of workplace committees to promote a health and safety plan that include wet mopping and safe disposal of cotton dust, provision of simple face masks, and further publicity about the risk from the cotton dust. Participating mills were randomized following baseline data collection. The impact of the intervention was measured through surveys at 3rd, 12th, and 18 months using questionnaires, spirometry, and dust measurement. The primary outcome was changes in the prevalence of composite respiratory symptoms variable, changes in the post-bronchodilator percentage predicted post-expiratory volume in 1 second, and changes in cotton dust levels. These were assessed using two-level mixed effects linear and logistic regression. Its results showed that out of 2,031 participants recruited at baseline, 807 were available at the third follow-up. Identified workers in the intervention arm were more likely to report an improvement in respiratory symptoms and lung function. Personal dust levels decreased more so in intervention mills, although although we did not observe this in adjusting model due to small number of samples. Conclusion is that they found that the intervention to be effective in improving the respiratory health of textile workers and recommending scaling up of such simple and feasible intervention in low and middle income countries. The next article is Occupational Health and Safety in Construction Industry in Pakistan using Modified SIRA method. For any industry, occupational health and safety is a business strategy to foster a safe and healthy working environment. In the developed countries, the companies are focusing on workplace safety in order to reduce harmful results. Harmful impacts on human health, environment, economy, productivity, society, and reputation of a company. On the other hand, the construction industry in developing countries like Pakistan are not properly focusing on occupational health and safety because of high cost of PPEs, safety trainings, and activities. The objective of this research paper is to identify the critical hazards, causes, and consequences and to prioritize the most critical and harmful criteria and alternatives. For this purpose, a method called Modified Safety Improved Risk Assessment, whose abbreviation is Modified SIRA, was used. Within the Modified SIRA, the criteria and alternatives are prioritized based on risk priority number and MCDM methodology called fuzzy tosses, that is technique for order preference by similarity to ideal situation respectively. The results of RPN shows that most of the accidents in cotton industry of Pakistan occurs due to deficiency of personal protective equipment followed by electrocution due to electrical equipment. Improper way of using available personal protective equipment and falling of personal from elevated platform. Similarly, the results of photosis shows that chemical and fire hazards are the most responsible for the accidents in cotton industry of Pakistan. Coming towards the MCQs, first MCQ is cold-worker pneumoconiosis, that is the black lung disease, is a lung disease caused by deposits of coal dust in the lung. Which of the following is the first statement about the black lung disease? First option is it results from inhaling coal dust or graphite over a long period of time, or it is a type of emphysema. Its symptoms are most likely in smokers. It can cause disabling shortness of breath, or it can cause lung cancer.
A.
Uh, no, it is like an emphysema. Asbestosis is widespread scarring of lungs caused by breathing asbestos dust. Which of the following is responsible for the large number of lung cancer caused among people with asbestosis? Whether the cigarette smoking, genetic predisposition, having other lung disorder, level of exposure or to asbestos fiber, or level of exposure to asbestos gas.
E.
It's is
E.
A is cigarette smoking. Mr. XYZ has been working in ceramic industry for last 12 years, dwells fatigue, shortness breath, loss of appetite, and chest pain. His chest X-ray shows ground glass appearance both lungs. What is your probable diagnosis? Whether accelerated silicosis, anthracosis, megasosis, chronic silicosis, or acute silicosis?
C.
It's D. Chronic silicosis. Bagososis is more C. That is bagososis. It is caused by inhaling the sugar cane dust. It's chronic silicosis. The patient XYZ visited a pulmonologist with the complaints of cough and blackish symptoms. His pulmonary function test shows slight decrease in at forced vital capacity. His chest X-ray showed 1 to 2 millimeter nodules all over his lungs. On taking history, he told he was a coal miner for last 7 years. Which of the following is not true in this case? Whether his condition is irreversible, his disease would progress if his picture is not stopped, he is suffering from complicated pulmonary pneumonia, he is suffering from simple pulmonary pneumonia, or suffering from lung cancer.
D.
It's C. He is suffering from the coal worker pneumonia. Recently, some of the workers of a coal industry started developing cough, extreme soreness of breath, and fatigue due to which they were not working properly, or was sent to physician for medical checkup by a company who further referred them to pulmonologist making a diagnosis of coal worker pneumoconiosis. Which of the following is the best way to differentiate between simple and the complicated coal worker pneumoconiosis? Whether the size of testes on lungs in chest X-ray,
A.
some years of coal industry pulmonary function tests, are the sputum examination. Yes, it is differentiated by the size of the testes. System MCQ is people working in textile industry are prone to develop crippling lung disease due to inhalation of cotton fiber. The development of dysnosis can be prevented by all of the following steps: periodic medical examination, good personal hygiene, promoting dry cutting and prohibiting wet cutting, conducting air monitoring, frequently food ventilation system.
B.
C.
It's C, promoting dry cutting and prohibiting wet cutting. A middle-aged man working in a shipyard industry for last 40 years developed cough, hematoxis, shortness of breath, hoarseness, voice, and weight loss. He went to the hospital for his checkup, where he was diagnosed as the cause of mesothelioma. What is the main cause of mesothelioma? Whether silicosis, anthracosis, asbestosis, pharmacology, or the pneumoconiosis?
D.
Please see asbestosis is the cause of the mesothelioma. Silicosis is most common occupational lung disease caused by inhalation of dust containing free silica, silicon dioxide. Which of the following is not correct about it? Whether it is not a reversible disease, it has strong association with smoking, it has strong association with depression of job exposure, it is of two types, acute, and the second one is chronic.
C.
Yes,
C.
yes, it is. Ninth MCQ is silicosis is the commonest lung crippling disease that has no cure, but it can be prevented. Which of the following is the best preventive measure when dust level is above the recommended dust exposure? Substitution of the silica with other methods, wearing goggles and earmuffs, frequent costume changing and washing hands at worksite, wearing a respirator, wearing a personal protective equipment. Yeah, the best
C.
measure would be the wearing a respirator. Last MCQ is a 40-year-old man working in a grain market for last 20 years started presenting with history of frequent infections for last 1 year. His chest X-ray shows pulmonary fibrosis. The likely diagnosis would be tuberculosis, silicotuberculosis, megasosis, farmer's lung, and that's asbestosis.
E.
It's farmer lungs. The workers of the grain, the workers of the grain dust most likely are to develop the farmer's lung. This is the key of the MCQ, and this is the YouTube channel of the community medicine department where all the presentations are uploaded. And thank you very much for today.
Thank you very much, Dr. West, for a very wonderful lecture. And you are also